So another thing to talk about is the possibility of tube feeding, enteral feeding. My son is entirely dependent on his feeding tube for all fluid and nutrition. He started off with an NG tube, which goes in through his nose and down into his tummy. Nobody thought he would cope with that, me included. But we tried, and I'm so glad we did. Oliver is autistic and has learning disability, but still has coped for a good 4 months with that tube without pulling it out and without fighting it. It was like a relief to him. The pressure was suddenly off and he was getting nutrition without having to eat. He then had a surgical feeding tube, a PEG, and that goes into his stomach directly. And he's had that for around 2 years now. Oliver has grown, Oliver is happier, and I just want other parents to know that it's not so scary after all. You know, we all hear about feeding tubes and we all think that is an absolute last resort and that is the thing to avoid. In some cases, it can be a really good thing, especially if you're looking at therapies further down the line like CBT or food chaining. Often that is more successful when the pressure is off, and a feeding tube does exactly that. It takes the pressure off.